Hello again, everyone, and happy Friday. It is my great pleasure to welcome you and thank you for joining today's event, the Lupus Wellness Workshop. My name is Stacy Bell, and I'm fortunate to serve as the Chief Clinical Research Officer for Lupus Therapeutics, the clinical affiliate of the Lupus Research Alliance. I'm so pleased to welcome you to this event today. It's timely and so much needed for those living with lupus and their care partners. We have heard from so many individuals about how their lupus is impacting their life and the importance of having tools and resources to aid them in their overall wellness and really the overall wellness of our community. So we wanted to hold specific space to do that together today. I'm now going to introduce you to our amazing MC for the event, Shanelle Gabriel. Shanelle is a Brooklyn, New York based poet, keynote speaker, communication specialist, and lupus advocate. She has graced global venues such as Carnegie Hall and the Vatican, all the way to HBO's Deaf Poetry Jam. Shanelle has facilitated trainings to improve community engagement and interpersonal connection in schools, districts, and organizations. Diagnosed with lupus in 2004, she has collaborated with the NIH, delivered keynotes to congressional hearings on Capitol Hill, and been featured on the cover of USA Today on her journey. She is also a producer and host of the Better Together, Sharing Our Lupus Stories web series on living your best with this illness. Shanelle, it is a pleasure to have you today. It's always amazing to partner with you, and I'm so grateful that you can be the MC for today's workshop.
Thank you so much, Stacy. Thank you for this. And I'm so excited to be a part of this event and contribute to it. Hello, everyone. So great to have you. Once again, my name is Shanelle Gabriel, and this is important. So I celebrated my 21st Lupiversary, my anniversary of being diagnosed with lupus, this past July. And it's been a journey with many ups and downs, like I know many of you have witnessed and experienced. So I've been on many different treatments to manage my symptoms, but one thing that's always been important is just finding the balance between what my doctor tells me and the things that help my body feel its best. And so I really believe that, mental, medical, and physical health is important. All of that's there. So while I know many of you are trying to conquer the world, we all know we cannot pour from an empty cup. So I'm very excited that the Lupus Research Alliance has created this space for some really important activities and conversations that can contribute to both our mindfulness as well as our wellness. So, moving to the next slide. Today's workshop, we're going to be taking a look at a few different things. We're going to talk a little bit about how clinical trial participation can support your health journey. And here's our agenda. So we have our welcome, followed by some expert-led sessions. First, we'll have a presentation on clinical trial participation and wellness. And then we will move into a mindfulness and meditation session, which I am looking forward to, just calming it all down. We'll also do some gentle movement activities, and then we'll wrap it all up with much needed stress management techniques. So I hope you're all excited to be here. I know I am. And please note, we've created this event with you in mind, and we have brought so many different experts together. And we hope that the goal here is that this event offers useful tools that you can use with each session and use continuing on into this journey and into this holiday season. So if you're excited to get started, feel free to put in the chat or just say something like, yay, or give yourself a little yay, because I know it's sometimes at 12 o'clock in the middle of the day on a Friday, you took time for yourself. It's important. All right, so ready to get started. I'm going to introduce our first guest, our first expert. I'm going to introduce and kick this off, this wellness workshop, with our speaker, Ben So. Ben is a rheumatologist and clinical researcher working with Adicet Bio, who has been designing and conducting clinical trials for the past 20 plus years. He has worked in clinical development departments of multiple pharmaceutical and biotech companies. Now, Ben is passionate about finding better treatments for people living with lupus. So we're so excited to have you here. Thanks for joining us, Ben. Welcome to the stage.
Thank you so much, Chanel. Thank you. It's great to be with everyone. It's wonderful. We got over 100, and I think we have hundreds of people registered for this workshop. So obviously speaks to how important this topic this is. So I'm here to talk about clinical trial participation and wellness. And I think the next slide is just my disclosures. So I am a full-time employee of a biotech company called Adicet Bio. The next slide is this question. So, can participation in a clinical trial impact your overall wellness? I mean, we don't usually think about clinical trials related to wellness, but hear me out. I'm going to build the case for this. So, the next slide. So, what are the potential benefits of participating in a clinical trial? First of all, for you, you get regular, ongoing medical attention from a team of healthcare professionals for the duration of the trial. So it's sort of like an added-on medical attention on top of what you usually get from your doctor. Um, Additionally, you can get free access to novel treatments even before they become widely available. And then, thirdly, and more importantly, you get to participate in clinical research that makes you really part of the solution, which is to develop better therapies for people living with lupus. Better treatments, better outcomes. That's what we're all working to do in the clinical research area. So this is really an opportunity. You shouldn't look at participating in a clinical trial as a like something that someone makes you do or that you're forced to do. It's really an opportunity to be part of the solution. Okay, so next slide. I have to explain a little bit about clinical trials so we're all level set. So a little bit of clinical trials 101 here. Next. So, what is clinical research? It's the study of health and illness in people that are intended to add to our medical knowledge. We do this kind of clinical research in the setting of the doctor's office, so clinical care settings, or in the context of clinical studies. And it usually involves getting biological samples, documenting people's experiences, and following what clinical outcomes people have. Next. What is a clinical trial? So, a clinical trial is a type of clinical research, and it usually is going to involve some kind of study of a treatment or of some what we call an intervention. But I'll go into there are a couple other kinds of clinical trials. But clinical trials are a type of clinical research, and they usually have a specific question. We call it a hypothesis. They could be like, will this treatment help people? Is it safe? Will making this lifestyle change impact their daily lived experience? So in clinical trials, first of all, this is entirely voluntary to participate in. You need to agree your consent to getting the intervention in the clinical trial. And then it's actually your job to share your experience with the clinical researchers who are trying to ask these questions. The clinical trials are helping researchers and providers decide if the benefits outweigh the possible side effects of the intervention, usually. And lupus research really has been greatly advanced by people who participate in clinical trials. We can't have gotten to where we are without doing research and doing clinical trials. So next. There are a couple common types. I just spoke mostly about the interventional trial. So there's some sort of intervention that's given during the trial. Usually in these kinds of studies, the participants are assigned to a group that gets the intervention and then another group that doesn't get the intervention. And we compare the results. So we're sort of isolating the effect of what is the intervention on the person's health outcomes. An intervention is commonly thought of as a treatment, some sort of a new therapy, but it as well could be a procedure. It could be like an exercise program. It could be a diet. It could be doing yoga. Any of these things are sort of an intervention. It's just that you study it in an organized way in a clinical trial. There's also observational trials or observational studies where there isn't an intervention, but what we're doing is we're also in an organized way tracking what's happening to someone over time and seeing what are the characteristics of the people that have certain outcomes versus the ones that don't have certain outcomes over time. And so these observational studies are important for us to really understand like the natural history of lupus, or maybe let's say if you're looking at people who are pregnant who have lupus, what is the outcome with their different treatment patterns that occur. So these observational studies are important. They set you up for being able to do in the future a clinical trial perhaps of an intervention or a program. Next. So what do you expect from a clinical trial? You're interested in participating in a clinical trial. And I'm just going to break it down into these kind of four phases for a clinical trial that we require. It's really important for you to interact closely with the study team. So the first one is your potential participation in a clinical trial. You're going to get informed consent. This is often in the form of a fairly large document with lots of text that's explained to you, but we are working on other ways of, like conveying this information by video or having audio type of explanations of informed consent. But this is really your introduction to the study. You get you get to meet the study team, the study doctor, and the study team. And it's really important for you to build rapport with them. You're going to hear about the reason for the study, what kind of people are eligible for participating in the study. You'll hear that you have rights, that your study participation is completely voluntary, and that you'll hear about the risks of participating in the study and how people will try to mitigate the risks. And then ultimately, you'll understand really what the study involves and what is expected of you. So this is a very important part. Don't look at it like when you get an app on your phone and you get that long terms and conditions, you just skim through and you get to the end and agree. It's really important for you to understand what the study is and have all your questions answered. The next phase is screening. So at screening, you want to continue to build rapport with the study team. You want to get to know each other better. You're going to go through various screening tests and assessments, maybe some lab testing. And that's to determine if you are indeed the right kind of person that the study is designed for. You shouldn't feel bad if it's decided that you aren't really eligible for the study. It's nothing on you, but it's just really on the way the study was designed and the kinds of people that the study was seeking to evaluate, to assess in the study. So this is another period definitely to get to know the team, because the next step is that if you are eligible for the study, then you enroll. And that's when you're really in the clinical trial. So you'll get assigned to a treatment arm. Usually you get training on how to take the study drug. It could be a pill, it could be an injection. It could be you can be even more involved, like the cell therapy I work on. There's going to be more involvement where you're even going to be hospitalized, and so you just need to be aware of that. You'll be shown the schedule of clinic visits and the lab tests and the different assessments that you'll be doing, and then throughout the course of the study, you'll be like doing questionnaires and you'll be having different assessments. So there's has to be a lot of communication, and I just can't emphasize enough how important it is for you to interact with your study team as a participant, as literally the contributor to the data that's coming out of the study. You shouldn't be seeing yourself as like an object of assessment, but really a contributor, a participant. And so it's really important to be truthful, to tell people what it is. Sometimes we hear about people that participate in clinical trials and they're not forthcoming about some sort of side effect they're having because they're afraid that it's going to knock them out of the study, and so they don't tell it. Be truthful. I mean, we really need to have accurate data and honest honest reporting. The questionnaire is the same goes. Be truthful. Don't try to guess what the doctor wants you to write on the questionnaire. This is the only way we get good feedback on the study and what its effects are. And then finally is completion. Completion is when your participation in the study period, and study periods can be, for lupus, can often be like months to even years long. And so you go through the study for that amount of time, you complete the study, and we gotta make sure that that the data we've collected from you is complete. So you may get some follow-up questions, but this is also a phase where you should make sure that that there's a mechanism for getting access to the study drug after the trial. Let's say it's a late phase study. People have pretty good sense that the drug is going to be worth going for approval from the FDA. There's usually some mechanism that's designed in for access to the study drug even before it's approved. So that's something definitely to ask about and to see how to take care of that access. And then the second part is that more and more, I think researchers are hearing the patients are asking for what are the results of the trial? I did all this and you collected all this data from me and you got all these lab tests done, but what were the actual results? And you just have to realize that it does take a while to do these clinical trials, and you may not, I mean, after you complete your participation, it may be actually a couple years before the last person in the trial finishes their collection. And so it's important just to make sure that you leave your contact information, that you can stay in touch with the study team if you want to get results of what happened with the trial from the study team. Okay, so I just tried to outline the fact that you are an active contributor, a participant in the clinical trial. You are the most important person. So to get the most out of the trial, you need to communicate and you need to really understand what you're involved with. And that way you'll get all the attention, that you get from these clinical trials. Next. So really, just underscoring, participate actively, ask the questions, read the informed consent, and just don't be, like a passive guinea pig in the trial. I've had when I was in practice, patients would tell me, well, I don't want to do that because they're just going to treat me like a guinea pig. But what I'm trying to tell you is that, for your own sake, for your own understanding and self-awareness and wellness, you participate and not act like a guinea pig. Make your voice count. Report any of the new symptoms or possible side effects that you're feeling. Even report the benefits that you may be feeling. Answer the study questionnaires honestly and communicate with the study team. It's a very active process that I'm advocating. And in that way, I think that you will gain yourself more self-awareness and you'll be better attuned to your own health through this kind of participation. Next. And then to kick it up a level, advocate for lupus clinical trials. Let's say you did participate in a trial, spread the word in the lupus community about how you participated or what the need is, because the need is great to participate in clinical research and to be represented. Every person living with lupus is a little different from the next. We always hear how heterogeneous this disease condition is, and indeed it really is. So make yourself counted. Also, I've been involved with sometimes where a group of patient advocates help to advise lupus researchers or a biopharmaceutical company on the design phase of the study. So you have the power to give substantial input in, okay, this is how the study should be. This is the kind of thing that matters to me, matters to us as people with lupus. And that in that way, the lupus trial that's designed that you may not even participate in, but others will be able to give their feedback on things that really matter to people living with lupus. So advocate. Next. So I'm just going to conclude by saying that participation in a clinical study does improve your wellness. You become more self-aware by participating in the trial. You really get attuned, I think, to some of your own health issues as you go through and you like answer questionnaires or you answer the study team's questions about how you're doing going through the trial. Um, you you really, if you have a positive experience, as I just said, try to educate others, empower others. I think that the lupus therapeutics has this patient advocates for lupus studies, the PALS group, that they're there to really um, advocate to others and to educate others really on participating. I think that's very powerful in spreading it across the community. And by doing so, we know that if you volunteer or if you do service for others, that also increases people's sense of well-being and your motivation and overall wellness. So by this, lastly, at the same time, your contribution as a trial participant does lead to development of better therapies. We figure out what really works, and that in so doing, it's like the rising tide that lifts all the boats. Your contribution raises the tide, and everybody in the community or all the boats in the harbor, can improve their overall well-being. So thank you very much for your attention, and happy to take a couple questions if we have them.
Yes, we have a few questions that have come in. I do have one before you even get into them. Just letting everybody
Okay.
know. Yeah, just letting everybody know if you want to ask a question, please don't use the chat because we have all these people from all over the world that are saying hello and saying where they're from. We might lose it. So please click on the little button that says Q&A and there you can submit your question. We'll try to get to as many of them as possible. But I definitely wanted to bring up something that you mentioned, Ben. You talked about informed consent. Now, I know a lot of people look at clinical trials and they think historically, everything hasn't always been ethical and things of that nature. But what are the things that have been put in place since, I'll name them,
Mhm.
Tuskegee, other
Mhm.
countries, things like that. What are the things that make clinical trials a little different than they were back then? And
Oh, yeah. I mean, a lot, basically. A lot has been put in place. I mean, a lot of the regulations, all the between the different regulatory agencies like the FDA, the fact that we have institutional research boards, called the IRBs at every hospital. They govern and they make sure they'll have like a person from ethics on those committees. They'll have patients on the committees that review the studies and make sure that they are conducted ethically in a fair manner. There's a lot of scrutiny on making sure that no one is unfairly treated. And I emphasize again, it's entirely voluntary to participate in clinical trials. You withdraw at any time.
Mhm.
There's nothing, no aspersions cast upon you if you drop out of the trial. And that's a very different thing from like Tuskegee, right? Where people just didn't even know and they were being tested and infected with things. And it's just we've come a long way, and there's a lot of regulations in place to ensure that people are fairly treated.
Oh, thank you. That's a great response. And just to bury not to bury the lead, I've actually been a part of clinical trials, and I definitely know that they give you a lot of details and a lot of details and stuff like that. So you mentioned informed consent earlier, and
Yeah,
but
yeah.
I know we have a question in the chat. I'm sorry, not in the chat, in the question
The
Q&A
Q&A.
function. And someone asked, can patients have other underlying autoimmune illnesses, or do you only have to have lupus for clinical trials?
It really depends on the clinical trial. We do know that there are studies, including like the one that I'm leading, where we're studying multiple different disease conditions, and so they can have lupus and like Sjogren's or something like that. But other ones, they do really want to focus on lupus, some aspect of lupus, and so it'll be more like restrictive about in the eligibility criteria that it can be has to be only lupus. It really depends on the trial and
Mhm.
what they're trying to study.
Definitely. Okay. So it sounds like every trial is a little bit different, but
Can
some
be
say that
different,
you can
yeah.
have
Yeah.
others and some might have more restrictions. Got it.
Yes.
Got it. Okay. We have another question. In a clinical trial, are you allowed to continue with your current medications?
Ah, and that also depends on the clinical trial, but we know since there are medications that are effective for lupus, we tend not to try to take people off of them, but to add on to what they're existing. So it depends again on the trial. It depends on like, is there going to be some sort of interaction that we don't want to have? Like, we would be overly immunosuppressing somebody if we put like what the study treatment is on top of the background. So
Mhm.
in most cases, yes, people are able to continue some of their background medications, some or all, but in some others they're not. Yeah.
Definitely. So
Yeah.
for those of us, like I mentioned, we have people from Grenada in the house. We have people from Canada.
All
And I think I
right.
saw that this is somebody from Canada that asked this. For those of us that don't
Amazing.
live in the US, are we eligible for the studies originated with researchers in the States?
Ah, that does get a little more complicated, right? When we do clinical trials, they are under the auspices or the oversight of the regulatory agency in that country. So Health Canada is going to oversee a study being done in Canada. If you're going to cross the border, I think that may depend on the trial. I think usually that can be done. That can be done, and I've seen it done. Done it myself, but it just gets a little more complicated. But I don't know if that answers your question. But generally, like if the Canadian is going to a trial site in Canada, that's going to be requiring that Health Canada has approved the conduct of that trial in Canada. But crossing the border, that could be kind of more case by case basis, trial by trial basis.
Definitely. So yeah, I can imagine you're trying to get regulations happening here. We have somebody from New Zealand. See, these are all the questions that people are asking. But I mean, I think that while a lot of the people that are on this, we're all U.S. based. I definitely know that like clinical trials are happening all over the world. Correct?
Yeah. And there's this kind of phenomenon of medical tourism, right? So
Mhm.
I am, yeah, currently conducting a trial where people are, so the study doctors are like international experts, and they say like, I got this person from Brazil wants to participate in the trial. So it can be done. We can make it happen. But it is just obviously a little more complex to bring somebody over from another country.
Oh, well, awesome. Well, thank you so much, man. I mean, this was really, really helpful. And if somebody's interested in learning more or getting in touch, how might they do that?
Yeah, you can contact me. Y- Here's my contact information. You can email me or you can call me.
There you go. Everybody, no spam, but you can contact Ben and learn more. Thank you so much for sharing all this
Okay.
wisdom. And this is really, really important to learn all of this. Yes, thank you.
Okay. Thank you for allowing me to be part of this.
Yes. All right, everyone. So Ben's presentation offered a lot of information on clinical trials. Now, if anyone is interested in exploring being a part of a clinical trial that might be right for you, Lupus Therapeutics, who's hosting this lovely event, has a useful resource on their website. So it's a brief questionnaire, and your responses will also help you identify studies that you may qualify for. Now, of course, always please consult your healthcare provider before deciding to participate in a clinical trial. Now we have a QR code for this resource that's on this slide as well. If you're interested in checking it out, just take your phone, put your camera function, and it should take you directly to the website. And for more information on clinical trials, there's another link breaking down the phases of clinical trial development and other helpful information. And that's put in the chat. So, and once again, thank you for letting the chat know, using the chat to let us know where you're from. We have folk from all over the country in the US, as well as everywhere around the world. And I see questions coming in. Keep them coming. If you have a question, make sure you click that Q&A button, and we'll try to get as many of them as possible at the end of the different segments. All right. So, wow, I see South Carolina's in the house. I see quite a few people. Quebec. Oh my goodness, everywhere. Michigan, all these wonderful places. Well, we're so glad to have you. And today, now we're gonna you talk about the next session. As we all know, relaxation and mindfulness are things that are very hard to come by nowadays, but they are the key in managing the daily demands that life brings. So, our next session will be led by Jane Whedon, who will offer a guided meditation. Jane is a licensed physical therapist with over 20 years of experience with her own practice in Brooklyn, New York. Brooklyn is in the house. Her focus is on a mind body holistic approach. She has studied and practiced meditation for over 35 years and has led mindfulness workshops and classes for children and adults, and currently leads weekly online energy healing meditations. Jane, thank you so much for being here. Passing the mic over to you.
Thank you. I'm so happy to be here, and I love sharing meditation. It's a great tool for all of us, and we don't need a lot of things to do it. We just need our mind and our hearts, really. So, yeah, I've used a lot of meditation techniques with my clients, and I've developed some guided meditations that I think can be really helpful. So we can just start. What I do want to say is that this is totally guided. And you don't even have to follow my directions. If something comes up for you and it feels like you want to do something a little bit different, sometimes I use a lot of imagery. Like, for example, I may say, envision a certain color, like red or something, and you see gold. Gold is perfectly fine to do. So meditation is really about getting closer to yourself. So I'd like you to just get comfortable in your chair. And also, you can always just move your body whenever you need it. There's no fixed position. And you're just going to let your eyes close. I'm going to close my eyes along with you. And just take a few breaths in and out. A few breaths in and out. First, we're going to get in touch with our body. So just feel your feet on the floor. Just notice your feet. And pretend you have a beautiful magic marker. And you're going to outline your feet with this marker. Just how you would outline your hand when you were a child with your turkey, trying to make a turkey. You're going to outline your feet. And this marker's full of beautiful energy. Notice how it's glowing and sparkling. Just feel your feet connected to the floor. Allow the floor to support you. Going to move up your body to the next place that's being supported by your chair. That's usually your buttocks, back of your thighs. And just use that outline marker also to outline around you. Let the chair support you. Going to work your way up to the next place that's being supported by your chair, and that's usually the back of your chair. And even though you're vertical, you can still outline your body with this magic marker, outlining your back, making that connection with that chair. And then just notice where your hands and arms are. They may be in your lap or on an armrest. And it doesn't matter what position, you're just going to outline them. That magic red marker. Just take a moment and remember those places we just highlighted. Your feet, your buttocks, your hands, your back. Allow yourself to be supported. So often we don't support ourselves or allow the support that we have. Allow yourself to be supported. Another support we have is our breath. It's an internal support. We're going to allow our breath to come in and support us there too. So we don't have to do anything to fix our breath. We're just going to notice it. There's many breath techniques out there. I prefer to just trust our body and let it breathe and know what it knows to do. Just notice the breath coming in and then notice how it goes out. Just how it comes in and goes out. That's all it does. Body knows what to do. But you can also be curious about your breath and just see if there's a little bit more capacity to take a little more in. Maybe you had room for a little more. We're not pushing, we're just seeing and being curious. Do I have a little bit more room? Can I take a little more in? And can I allow a little bit more to release and let go on my exhalation? Not pushing or forcing, just seeing what comes naturally, stepping out of our own way to see if we have a little more room. You can let yourself sigh if you want. Often sighing and yawning is a readjustment of our breath as we slip into a little bit more expansion and relaxation. Notice that your breath, as you transition from inhalation, there's often a little bit of a pause. I often think of it as a roller coaster when you're just reaching that peak before it transitions. So we're peaking into inhalation, into exhalation, and there's a little bit of a suspension there. We're not making it, we're noticing it. And after our exhalation, there is often a pause, an emptying out. Can you allow that to happen? Often we rush the intake of breath because we get anxious about that empty place. Can we explore that and see if that's okay with us? So the natural rhythm of the breath is inhalation, slight suspension with that transition into exhalation, then exhalation to an empty place before we inhale again. But we can trust our body that an inhalation's coming again. Take a few moments in silence just to notice those 4 stages of the breath. Just be in your breath. Moment of silence. Great. Now, take that magic marker. And instead of ink, it's full of beautiful energy. In your mind's eye, you're going to outline your body. So you're going to start at your left big toe. You're going to come up the top of your shin, over your knee, over your thigh, over your hip, up the front side of your left side of your body, into your left armpit, down the inside of your arm to the palm of your hand, round over the tip of your fingers to the back of your hand, the back of your left hand, your left arm, into your shoulder, left side of your neck, over your left ear, over the left side of your head, over the top of your head, transitioning to the right side of your head, over your right ear, right side of your neck, down your right shoulder, down the back of your arm, down the back of your hands, over your fingers, to the other side, to the palm of your hand, inside of your wrist, inside of your arm, up into your right armpits, down the right side of your body, over your abdomen, stomach, hip, down the right thigh, over the right knee, right shin, ankle, over the top of the right foot, over the toes, along the back of your foot, of your right foot, over your right heel, up the back of your leg, your back calf, your knee, back of your right thigh, over your right buttock, to the small of your back on the right side, up your back to your right shoulder blade, up into your neck to the very top of your head. Make a loop and come back down the back of your head, back of your neck, down the left side of your back, and down over the left shoulder blade, over your back into your low back, over your left buttock, over the left of your back of your thigh, back of your left knee, back of your left calf, over your heel, down, across your foot, into your arch, back of the toes, up around to meet up to the top of your foot where we started. Just take a moment and feel that line of energy in that path that we just did. If you can't remember it all, that's okay. Just imagine that line circulating on your body, beautiful healing energy, bringing you vitality, peace, calm. Whatever you need today and whatever comes up for you is exactly what you need in this moment. Now you're going to think about that line and let it sink into your body, that pathway of energy flowing, going deeper into your body. Feel it circulating all through your body. Just see how that feels. As we start to wind up our meditation, just remember that you can bring this back to you at any time. One way to do that is to just recall an image, a thought, a feeling. Maybe it was something I said, sensation you had during this meditation that's kind of stuck out or resonated with you. And that's your key back into this meditation if you want to do it on your own after this. Take one more moment. Feel your body in your chair. You can start to wiggle your fingers and your toes. You might even want to give yourself a squeeze or a hug. Sometimes that brings you back. You could slowly open your eyes. Sometimes squeezing our hands, big hug. And we're back. Great. I hope that was good for you. One thing I want to say, meditation doesn't always have to be about quiet. It can also be energizing and vitalizing for you too, but not in a frenetic way, in a calm way.
Oh, thank you so much, Jane. That was wonderful. And I mean, I was zen, really zen in that moment. It was so helpful. I hope everybody else thought the same thing. If anyone's interested in getting in touch, how might they do that?
I have my website. You can contact me at my website. I do want to say too that I'm going to put up this video that's kind of like a follow-up for this. So, like a short video. So if you want to try this on your own, you could always click on to my website and find it. It's not quite up yet. It's going to be. And then I'm going to start putting some more meditations, free meditations on my website too. So, it's good to remember meditation is a practice. It's something we need to do, like brushing our teeth.
Yep, definitely. Oh, I have one quick question. I know we're running a little behind in our schedule, but can someone asked, Dan asked, can I meditate lying down if I'm having a flare, lupus fog, or fatigue? And
Oh,
what should I do during the days where concentration is very difficult?
oh, yes. Oh, gosh. We could talk for that for hours. But yes, you can be in any position for meditation and you can move. There's traditions that want you in particular positions, but really it's all about what feels good to you so you can kind of calm your body down, especially if you're having a flare, especially. You want to just kind of be comfortable and calm yourself down. And that brain fog or and difficulty concentrating is really hard. Just the breathing alone can just really help that. Because a lot of times when we're feeling stress, and sometimes it's a stress that we're trying to repress because we're in a public place or something like that breath can just really, really help. So, yeah.
Awesome. Thank you. Thank you for making this feel a lot more accessible and a lot less, woo woo and a lot more like
Yes.
grounded and real. I think sometimes we don't always think about these as tools, and this was a really good tool that
Yeah,
you've added to a lot of people's toolbox.
definitely. Well, thank you. I'm so happy I could do this. So, good luck,
Thank,
everybody.
thank you. All right. I know some of you were like a little calm and you're like, oh my gosh, I'm here on my lunch break. I need to wake up. So really quickly, I'm just gonna ask everybody. I know we're in the chat and I've been using the chat just to talk with you all. But I think Jackie shared in the chat that she's newly diagnosed. Shout out to Jackie. If you were diagnosed this past year, everybody, if that's you, put a one in the chat. Let me know who was diagnosed this past year. I know we have a few newbies that are here in the building, the virtual building. Anybody else? There we go, Zara. Thank you. Oh, we have last month. Wow, wow. We got some newbies. Welcome to the lupus community, Monica, Sabrina. We have a few of you. All right, now, if you were diagnosed in the past, I'm gonna jump really far. Past 10 years, put a two in the chat. If in the last 10 years you were diagnosed with lupus, put a two in the chat. Mary, Melanie, Lenore, Angel, Michelle, quite a few of you, Raquel. All right, all our veterans. All right, now, last but not least, I'm going to go up. If you have been a lupus warrior for over 10 years, like me, put a three in the chat. Let's see, three. There we go. We got some OGs in here. Some people have been here for a while representing. Well, once again, this is a wonderful community. Please make sure you keep in touch with Lupus Therapeutics to find more ways to continue to engage with the community, as well as the Lupus Research Alliance. Okay. All right, now, just wanted to make sure our fingers are working, that we're still present and engaged. We're going to move into our next segment. Something that helps me in my wellness journey has been movement. I love anything I can do. Some days that's lifting weights, some days that's lifting a blanket. But it's important for us to make sure movement is a part of our life, and it can be very empowering. And sometimes we don't recognize how awesome our body still is, even living with this illness. So, on that note, our next speaker, Tim Gray, is going to guide us through a movement activity. Tim Gray is a top tier wellness strategist and award winning massage therapist. They got awards for that, y'all. And he is the founder of Gray Wellness, New York City's only Black owned wellness studio. With over a decade of experience, he served professional athletes, Broadway performers, executives, creators, performing more than 10,000 sessions rooted in Eastern medicine, bodywork, and cultural healing. Today, his work spans recovery programs, stretch therapy certifications, and national wellness activations. Whether on stage, on set, or behind the scenes, Tim's mission is simple: help people feel better, move better, and live longer doing what they love. Now, depending on your lupus and how you're feeling today, you may have more limited mobility, and that is completely okay. We ask that you please only do what's comfortable for you. And Tim will help provide a couple variations based on where you are with your mobility. And I'm going to be joining Tim on screen to show another example of what activity means for me. So, Tim,
Yes.
please take it away.
As I always like to say, peace to the kings and queens. Thank you for giving me the opportunity to share some time with you. As Shanelle said, my name is Tim Gray, and Gray Wellness is here in New York City in Union Square. We just celebrated our 12th year. I'm grateful to the community for allowing me this room and opportunity. So thank you very much for having me. Ready? Okay. So what we're going to do today is we're going to start from the root of the tree to the stem of the tree. We're going to start with the root. The root of your body is always your feet. And I do want to make sure that anyone who is sitting, laying, whatever position that you're in, you're always in the right position. Whatever makes you feel comfortable is the number one thing. If you listen to your body when it whispers, you won't have to hear it scream. Okay, so I need you to stay that with you. So if you are sitting like I am and your feet are on the floor, what I want you to do is put your feet in a wide position so your toes are out like so. So I want your toes to be out and flared. So what I want you to do is squeeze your toes and extend your toes. Feel the floor. Hopefully you don't have any shoes on. If you have shoes on, kick them off if you can real quick. I want you to feel the floor. Extend and tighten. Extend and tighten. So within this next part of the segment, I'm going to move back from the screen a little bit so you can see me a little bit more, because we're going to go from sitting to standing. Okay. So Shanelle, you doing it? Okay. So in and out, in and out, in and out, in and out. So if we're sitting, if you're laying, you can do this as well. So what I want you to do, we're going to start. So we got the toes moving in and out. What I want you to do is now kick, step up, one, and extend the leg. You can use the back of the chair as much as you want and extend. We want to get this blood flowing, starting from the feet. Now, here's the funky part, Shanelle. We're going to go in a V. So it's now out and out. Yes. And out. And out. Now we're going to come directly to the center now. So hold on to the base of the chair. If you're laying down, you can also do this. Both feet together. Together. So you're extending your legs directly in front of you. Okay, so one at a time if you need to, or same time. Okay, now we're going to go from there. Now we got that pumping. Now we're going to do the one thing in exercise that you do not need to figure out what it means. This is a squat. Since most of us are already sitting, we're just going to stand. Okay, so you're going to go from your seated position to standing. Key thing is to control it on the way down. Press through your heels, through your feet, and just stand. Take it up and slow it down. Yeah, Shanelle ran that one real fast. Now we're going to go stand it up. 3, 2, 1. Good. So now we're going to stand on this last one. We're going to stay standing. So breathe up. All right, shake it out. Get your Harlem Shake on if you need to. Okay, cool. 80. So what we're going to do is take this right hand. So my right hand, I'm going to put it to the side of my leg, and I'm going to reach for the floor. I want you to know you can do this while laying down or sitting. And back up, keeping the left hand tight to the body. We're going to reach for the floor. And up. Now, here's the best part. I'm going to step back so you can see more. Right hand to the side, other arm straight up. And reach. Tilt your teapot. And back up. Alternate to the opposite side. Reach for the floor. Tilt your teapot. Cool. Now, only thing I want you to do is touch both sides of your wall. Palms up toward the ceiling. And now you're just going to turn the shoulder. 1. Right. So try to keep your elbow down so your arm doesn't come up. Boom. Switch. Boom. Boom. Now we're going to speed it up just a little bit. 2, 3, 4. There you go, Shanelle. 1, 2, yes. 3, 4. So Shanelle can dance. We're going to add a little bit of extra. So we're going to turn. 1. Turn. 2. 1, 2. 1, 2. Shake it out. So I want you to get this energy in your hands. So here's an easy thing if you're sitting, standing, or laying. You're going to shake your hands vigorously, okay? And we're just going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, pause on 10, hold. You should start feeling your fingers tingling. You can feel that blood flow coming toward the body. This is how we make sure the body's alive, because movement is medicine. Okay, let's have a seat. Bring it back down. Now I'm going to teach you one of my favorite things to do. I'm going to take the palm, left or right hand, and I'm going to sit on it. Keep your legs wide, chest is up. Bringing the other arm directly up overhead. Just let your arm lay on your head. Don't pull. Leave this hand free. If your legs are wide, I want you to lean toward the side, let the legs up. Just let your arm do the weight. And breathe. Inhale through your nose, like you're smelling good food. Exhale, ha, like you're popping glass. One more, inhale, smell the food. Exhale, ha. You'll see you get a little bit lower. Can't fall because your body's being anchored by your hand. Now we're going to tip the body back up nice and keep it gentle. Raise the arm up. Shake the hand out. Opposite side. Have a seat right on it. Bring this arm right up. Straight up overhead. Let it rest on your head. And leave. You feel that neck stretch. Remember, we do not pull the head. Just let the body weight do its job. Inhale, smell the good food. Exhale up. You'll get a little bit deeper. Inhale again. Exhale up high. Let's tilt our bodies right back up. Nice and easy. Gentle lift away. Raise the arm up. Shake it out. Okay. So now that we did the tilt, now we're going to do the turn for the head. You're going to look as far left as you can over that shoulder. You're trying to look all the way behind you. Good. And back to center. Gentle turns. You're trying to look over the shoulder. Let's go to the opposite shoulder.
I think something cracked.
That's part of it. Okay. Shanelle, how are we feeling so far? Because this is an interactive thing.
Feeling good. Everything has been cracking. It's like click, 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 click.
So here's the other part. So since you're sitting in a chair like I am, or if you're sitting at home, most of us are sitting in a chair, I want you to turn the body. I'm going to turn the chair sideways so you can see it. Okay? So I'm sitting at the front part of the chair, and I'm just going to turn, grab, and look over, and then come right back to center. So turning, grab the back of the chair, keeping your body going forward. So we're getting some traction in the spine, right? So Shanelle, if you can, try to reach with your other hand, help pull you around. Yeah, just like that, and look. And then I'm gonna go to the opposite side. Nice. Okay, how are we doing? Not it's a nice gentle thing, right?
Feels
Not too.
good. Feels good.
Okay, so here's the fun part. You're gonna put your hands on top of your knees, and the only thing we're gonna do is round the back. You're trying to have your mid back touch the back, and then we extend our chest, coming forward, and then tilt the head up. It's like a cat cow while sitting. So exhale out, push the back all the way to the center of the chair. Inhale, drop the head. Back, chin to the ceiling. Look out. One more. Bring the mid back to the back of the chair, round the spine. A cat cow. And bring it back up. Present your chest all the way forward. Arch the back, chin to the ceiling. That in particular is a very good one, considering that most of us are sitting at a computer or on our phone. So our head has a tendency to drop forward all the way like this. So let's keep it going. But I wanted to check in real quick. Shanelle, we're doing okay?
Yep, we're doing good.
Okay, so
Feels
let's
good.
interlock our fingers, like so. Putting our head behind our head. Right. So here's the part that's going to be funky. You're going to tilt this right arm going toward the knee. Touch the knee. Sit back up. Good. Inhale. Smell the food. Exhale out. Ha. Touch the left elbow to the knee. Good. Bringing it back up. Now, here's where we're going to get funky. I'm going to sit back so you can see me, Shanelle. You're going to try to take this right elbow and slide it down inside of the knee to try to towards your ankle. Okay? So bringing it all the way down, keep your elbow attached to the elbow to the inside of the knee, slide it down. When you feel like you've gotten your stretch, sit back up. There you go. I'm going to turn again. Watch my inside of the knee, looking up at the elbow that's elevated. Oh, that was good. Come on back up. Okay, shake your arms out. Last one in this situation, we're going to do something called a good morning. So you're sitting and you're going to flex your body forward, but your arms are still going to be behind the neck. So the hands are behind, you're not pressing, just holding, and you're keeping your chest completely upright. And I'm just leaning forward, keeping your toes grounded on the floor. Your toes will support you. Go as far as you can. What feels good is good. Once you get to your end zone, push through your feet, coming right back up. Inhale like you're smelling good food. Exhale out. Present yourself forward. Reach, 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 reach. Press into the floor. Use your legs to push you back up to the center. Shake it out. So, just in case you want to see if anybody has any questions real quick as we're going.
Yeah, I'm looking to see. Yeah, this I can see the chat from where I am. I think we're gonna wait. If you have any questions, please put it in the Q&A section. I think there might be working out. So, and once again, I think what's cool about what you're doing is it varies. Like I can not go too far if my mobility isn't as there. I cannot turn as far. I think that that's really cool because this is all like self-guided in its sense, right? And I definitely want to say this quote, and I actually quote you quite often, Tim. Dan, the man, said, "Listen to your body whisper, so you don't have to hear it scream." always love that saying, and I tell you, I bring that quote with me, and I quote it. My friend Timothy Gray says this. So seems like we're doing that. But no, this was great. Was that I think we've done like quite a few exercises that I hope we can all do on our own. And even if you're like maybe your mobility is good or maybe you're able to work out, these are some stretches that, if you are actually active, you should be doing. Because I know a lot of times we think about lifting weights and things of that nature. We think about that, but we don't always think about stretching either. And have you seen that happen just in general, like where these exercises are something that needs to be included?
Well, I think that as human beings, we have a tendency to be influenced by what we see. So people usually see someone else's end result rather than the beginning. So
Mm,
the one thing I've learned is getting older, the beautiful part about getting older is that you lose mobility faster than you lose power.
mm,
So your strength will still be there. You ever heard of that term old man strength or something like that? So that will always be there. But the ability to move in space will deteriorate because you're not doing it.
mm,
Everything that we did here is in less than 4 feet of space. So
mhm,
if you're at
mhm.
your office, if you're at home, if you're traveling, you can do these things anywhere. And that's one of the
Mhm.
things that's the most important is that we didn't do too much, but it had a greater effect. Simple things go a very long way.
No, thank you. Thank you. Yeah, a lot of people, I got a lot of people saying this felt good. Someone said this worked really well in the office, and
Yes.
if you're struggling with joint pain. And I guess that's one other question I want to ask you. I don't know if I'm trying to look at the time, but I'm also having a great conversation. I'm just thinking about like how much our bodies, ache, as a person with lupus. And it's almost counterintuitive to like move and do movement. But why do you think we should still be active in movement? We know that mobility is a problem, but just I'm achy. I don't want to move. Why should I do that?
Well, the key thing is that your body doesn't know what it needs until you listen to it. So you not feeling in the space to move, you need to find gentler ways to move it because movement is medicine.
Hmm.
Everything that doesn't move is dead.
Hmm.
A tree, a tree waves, a flower moves. We listen to all of these types of things, but the movement can change. Meaning, I think that the association to what stretching is, like we're going to sit in these static positions for an extended period of time, or I have to do yoga that's going to make me more flexible. No, something as simple. One of my favorite things in the world to do when I don't feel like doing anything is literally just rolling over on the floor
Rolling
because
on the floor?
I'm not even joking because I don't feel like doing anything, right? So rolling over, I make that the laziest thing ever. So it's like, you know how if you try to pick up a child and they don't want to act as if they're not asleep and you have to pick them up and take them and just doing that on the floor or something like that. It's my favorite thing to do. Next time you do this on the floor, Chanel, I promise you're going to like it. Think about doing the backstroke in a pool by laying on the floor. It'll increase your mobility of your shoulder girdle, your chest, and everything because your back is completely flat, so you can't move it. But if I'm standing there and I'm just like stretch, 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 arm comes back around, you can't move. But your shoulder girdle, because you're sitting mostly as an anterior position, so your body's already here. Cell phones are here, computers are here, and here's one key thing that I want to state, particularly for the ladies here. Breast tissue pulls you forward. Okay, so if your flare up is happening, your body can be even more impacted by that. And 60 to 80% of women do not alternate their bra size based upon climate. So if it's in the summertime, what happens? You put something in heat, it gets bigger, it expands. So these small things like how our posture is in positioning, when
Yeah.
you're moving in opposite direction, it can create a release that you're not expecting because you're moving all of that fluid. So my
Mm.
point is, it doesn't need to be a big. It can be just something very simple and beautiful. And to all the human warriors in this room, something as simple as qigong. This is a Chinese form of movement medicine. You can do this anywhere. There are 10,000 YouTube videos on it, and it's gentle movements. So instead of thinking about mobility, we're thinking about moving energy. So if you're feeling inflamed, you want to move the energy because it's stagnant.
Mhm.
So I think
Definitely.
the reframing of the perspective of why we're doing something can be much more impactful of how we see it.
No, thank you. Just being able to loosen up is so helpful. And thinking about like where our bodies are, what our bodies are usually in, and contrasting that is super important. So, yeah, thank you, Tim. This was helpful. How can people reach you if they want to ask questions or learn more about your practice and your work?
Well, one of the benefits is that you can contact us here on Instagram. Of course, you can see myself, Mr. Gray, or our company, Gray Wellness, as well as going to our website, graywellness.com. And please have the opportunity for the people who are watching here to look at our podcast, which is on YouTube. It's called the Melanated Medicine Podcast. It's a 30-minute podcast talking about BIPOC healing through the lens of the people who are healers that look like you and me.
Awesome, awesome, awesome. And I appreciate this and I hope everybody, like I said, I see a lot of people that said thank you. They're at work and they're like, this helped me at work. We are so excited to have you. It was really great. Thank you, Tim.
It is truly my honor. And as always, we say at Gray, we're here to help you.
Thank you. Thank you.
Thanks, guys.
Oh, all right, everybody. We're starting to wind down. We're getting ready to wind down now. I know with the holidays coming up and all of the end of year rush and scramble and flurry of activities, it's only natural to feel a bit of stress and pressure. And we want to provide you with all the tools to help manage your stress a little better. So now our next session is going to be led by the wonderful Lily Stairs. Now, Lily is paving the way for women with chronic conditions to thrive professionally, drawing on her own journey from the hospital bed to the boardroom. Now, with 15 years of experience as an internationally recognized advocate and entrepreneur, she is the founder of Chronic Boss, the platform for ambitious women living with chronic conditions. Through her consultancy, Patient Authentic, Lily partners with top healthcare brands to design impactful patient engagement strategies. She serves as board chair of the Autoimmune Association and sits on the board of the Brain Cancer Research Alliance. Now, we know that lupus primarily affects women, but we definitely have some fellas in the building, and I know we all can learn from the techniques and things that Lily's going to share with us today. Passing it
Thank
over to
you.
you.
Thank you so much, Shanelle. And thank you, everyone, for being here and sticking with us for the last session of the day. I'm so excited to connect in and jump in. So we can go to the next slide, please. Chanel's done a beautiful job introducing me. And so, as she said, I am a three-time autoimmune patient. I live with Crohn's, psoriatic arthritis, and psoriasis. And so, while that isn't lupus, I'm sure many of you know there's such an overlap between autoimmune diseases and symptoms we experience, like fatigue and brain fog and joint pain. And so that's been my life. I've been living with autoimmune disease since I was 7. I was diagnosed at 19 back to back with Crohn's disease and psoriatic arthritis. I had a really severe onset, so total body arthritis to the point that my mom was dressing me and feeding me, and bleeding ulcers in my small intestine so severe that I couldn't drink water without feeling pain. I've been very blessed that I've been in remission now, for medically controlled remission, for over a decade. And I relish that. And I believe that stress management is actually a big part of staying in remission, because we know that stress is a big trigger for autoimmune disease. So we'll get to that. Um, as Chanel said, I am founder of Patient Authentic and Chronic Boss. I'm the board chair of the Autoimmune Association. I'm really passionate about helping women with chronic conditions pursue their career dreams. That's the focus of my work. All of this today is going to apply to folks living with chronic conditions and working, but also all of this is going to apply to you too if you're on disability or you're not working. This is going to be, painting broad brush strokes. There will be something for everyone. And I just wanted to share, to level set with all of you, that I am not a stress expert by any means. I, in fact, have lived a lot of my life in a state of stress. And I say this to be relatable, because I know that a lot of folks here probably listening in, you've got a lot on your plate. You're already managing lupus. Many of you may have families, you're juggling a job, you're juggling all the different things that come along with just being a human. And it can be really hard when somebody's like, don't stress, don't worry about it. I am one of those people who was never able to do yoga. Like, I couldn't figure out how to meditate. That's just not my vibe. But I have had to learn to slow down and try to manage my stress because it is dangerous to our health. And so I'm literally on this journey to find balance amidst my this is me and my fiance, we got engaged earlier this year, and I'm in the midst of wedding planning. I'm cat mom, my cats are there too, and I found myself getting too stressed, burning out because I was trying to juggle too many things. And I had to do like a forced reset to try to figure out how I could um, try to calm down my stress. And so I'm going to share a little bit about my personal journey with that and what I've done. And then I'm going to share some tips of other resources that I've tapped into over the years. Next slide, please. So, my goal for you in this presentation is to take away just one thing. I am going to throw a ton of different tools and tactics and resources at you. And the expectation is not that you do everything under the sun in this presentation. Some things will resonate, some will not. Take what works for you, but I don't want you to leave feeling overwhelmed. I don't want the presentation on stress to stress you out. The goal is that you walk away saying, okay, I really feel like I've got one or two things that I can integrate into my day or my week that's going to help me do some stress resets throughout the day. So that's the goal. So just keep that in mind as we walk through. Next slide, please. What we're going to cover, we're going to talk about why managing stress as a person living with lupus is really critical. Like I said, my personal stress reset wake up call, some toolbox and strategies, and then we're going to do a visualization exercise at the end to lock in your chosen stress management strategy. Next slide, please. Why do I need a strategy for managing my stress? And I'm going to actually have you jump right to the next slide as well. So I wanted to present some of the research. I won't spend a ton of time on this slide, but I think there is so much out there that connects autoimmune disease to stress. People diagnosed with stress-related disorders have a 36% higher risk of developing an autoimmune disease. Up to 80% of autoimmune patients report a major emotional stressor before disease onset. So we often hear stress is the number one trigger for autoimmune. Stress hormones are directly disrupting immune balance, increasing inflammatory cytokines that can worsen activity. So, all of these things, there are many studies, and this isn't a small study. This is really compounded over time that stress is a major factor in managing our conditions, and we have to do whatever we can to try to keep it at bay. It doesn't mean we're going to be perfect, and it doesn't mean we're going to have a stress-free day every day, because just living with an autoimmune disease in general can be stressful. But it means that we need to make maybe extra effort than the average person to do so. I will say that even beyond living with an autoimmune disease, there's more and more research coming out now that stress is actually in many ways tied to longevity. And people who are able to maintain their stress better in life and are not living in states of chronic stress can live longer. So there's more research coming out in that aspect too, which is pretty cool. Okay, next slide, please. My personal stress reset. And then you can go to the next slide too. I'm making our slide advancers do extra work today. Okay, so my personal stress reset. So here's what happened to me actually in the past year. I think I've mentioned that I have been pretty good about, I've been cognizant of trying to manage my stress over time, but there have been moments that have just spun out of control. So I was running my two businesses beginning of this year. I had just gotten engaged. On a personal note, I had worked really hard to try to find somebody who was my person and a fit for me. I did a lot to get there, a lot of work on myself, and then a lot of work dating. And it was very discouraging. It was a very challenging time in my life to get to find my person. So I was thrilled when I finally found my person. This is my dream. This is what I wanted. But what happened was I was so wrapped up in my work, I was letting work stress me out that I was agitated all the time. I wasn't even like getting to enjoy being with my partner and enjoy the wedding planning process because I was just on edge. I was stressed. And I knew I hit a point where I was working with my therapist, and she said, I think you're experiencing some burnout, and you really need to try to mitigate some of this for your health. So I read these two books, which I'm sharing here, that really helped in shifting my mindset. The Relaxed Woman and Toxic Grit. The Relaxed Woman talks a lot about how productivity has become a badge of honor in our society, and that, we often feel like we need to be productive in order to earn rest. Why do we have to be productive to earn rest? That's just a societal concept. And especially those of us with chronic conditions, you don't need to earn your rest. You don't. When you need to rest, you need to rest. And we need to build in rest into our weeks to ensure that we are giving our bodies that time to reset. So that book has a ton of tools and tips in it. I really loved it. And then Toxic Grit, this is a new book that has just come out this past October. I actually interviewed Amanda Getz on the Chronic Boss Unfiltered podcast. She's amazing. And she talks about how we all have these different characters inside of us. So we've got the CEO character and the partner and the caregiver and the doctor character, which is the one how we take care of our health, and the lazy person, and all of these. There's 12 different characters, and she talks about your life as a movie and how we need to be able to give all of these different characters screen time in our life, that they need to have the spot. So the partner needs to get the spotlight sometimes, and maybe it's the CEO that's getting the spotlight and the doctor. And we talk about how for people living with chronic conditions, sometimes the doctor has to be more at the forefront than we would like. So that's a really great conversation if you want to tune into that, and a great book for reframing how you think about servicing all the different parts of yourself. So those two books were instrumental in my mindset shift. Then I implemented a morning routine. I said, okay, what's happening is I am waking up every morning, and the first thing I do is I pull out my phone and I start scrolling social media and I look at my email, and I'm just like bugging out because I am now subscribing to everybody else's agenda and not my own. So now I wake up, which I never imagined that I could do this. I always thought I was going to have to grab my phone and be on my phone and look at what's happening in the world, but I don't. I get up, I don't look at any my phone or social media for the first hour or two of the day. I read. Sometimes it's a book like Toxic Grit, sometimes it's a psychological thriller. It's whatever I'm feeling like. And then I work out, and we'll talk a little bit about movement too, which Tim did a great job with. I have finally added yoga to my routine. I've been doing it consistently for about 2 months now, which is huge for me because I was like, I can't turn my brain off. I can't do this. Not going to work for me, but I'm making it work, and I'm actually really enjoying it. And then my evenings are reserved for my other parts of my life outside of work. And I wanted to share a couple of resources here. So, Brick is this tool that you can buy to help you stay off of social media. There are also apps on your phone that can help you lock out certain social media, but this is a physical uh, it's like a brick, it's like a block, and you put it in a different room. And the idea is that you have different settings on it, and you have to physically get up if you want to access apps on your phone that you've told yourself you want to turn off for a period of time. So that's a great tool. I picked up some new hobbies so that I am not picking up my phone. I've started doing hand knitting, it's called. And so I did that. I maybe go to a Hobby Lobby or somewhere where you could kind of browse and check it out. Again, this is in an effort to be less screen time, more doing things with my hands and kind of just trying to de-stress. And then I am massively prioritizing my sleep. The Aura Ring has been awesome for tracking. I know that there are a bunch of other tools that do it. There's also Aura Ring knockoffs because I know they're kind of expensive. So definitely worth checking out and seeing if your insurance will cover it. Sometimes insurance will actually give you some funds to put towards it. But that's been really interesting for me to look at the data and see that I was not getting very restful sleep. And so I've started to implement some changes to try to get better sleep. Okay, next slide, please. Okay, and then next slide again. So your toolbox, I am going to go through these relatively quickly because you already had an amazing meditation. So, and I believe you will have access to these slides. So you'll be able to access this after. But honestly, breathing does make it, if you are in a scenario where you're really stressed and you need a moment, go do one of these things. The breathing, the psychological sigh, breathing just, this is such an easy thing to do. And I used to not, again, this is another thing I didn't believe in until I started doing it. And I do notice my body physically relaxes when I do a quick reset like this. So definitely check that out. Next slide, please. I'm speeding a little bit because we're running short on time. Okay. Movement. So Tim did an awesome job covering this, but I wanted to just flag a couple of other options for movement that I think can be really accessible and really helpful. So a circ walk, I don't know if folks have heard of this, but it's called a circadian rhythm walk. And the idea is that the first thing you do when you get up in the morning, you get outside and you let sunshine into your eyes. It signals to your body, your circadian rhythm, that like it's time to wake up, it's time to get going, and that can be really, really helpful for your sleep. I have added a walking pad in my house. It can go really slow. You can just do it from home, get up, do 5, 10 minutes while you're watching TV or while you're working. It's a great way to get some steps in, especially if you live in a cold climate in the winter like me and don't feel like going outside. Another day with RA. This is Allie. She lives with rheumatoid arthritis. She has her own fitness app and she has all of these awesome accessible workouts like chair slice. So you can do a workout from your chair. She's just got the best energy. And again, they're short, they're accessible, they're designed for people who have chronic pain living with chronic conditions. And then You're Meant to Move by DK Sassone. She is a Pilates instructor. She lives with chronic pain, and she wrote this book all about daily movement and getting active in the face of recurring pain. And so this is a great book for people who are and with exercises included that's designed again to work around you and your specific needs as somebody living with pain or chronic condition. Okay, next slide, please. So with work, mindset shift, as I said, I work with Chronic Boss. I support women who are living with chronic conditions in work. I have here, these are 2 exercises that you can go check out and do yourself. So a secret sauce exercise. This is really important for mindset and thinking about how you can use the skills that you have and combine them with a superpower you've gained from living with a chronic condition to show what that's given you. And I'd like to go into it more, but I don't have a lot of time. So I'm going to keep going. And then an energy mapping audit. This is actually something that I've created. It's in an Excel worksheet. This can be used if you're working or not. It's just to help you figure out in your day to day what tasks give you energy, what drains you, and what's neutral. And then it helps you figure out where you should stack those tasks in your day based on your personal energy cycles. So if you have a lot of energy in the morning and your most draining tasks are you start those in the morning because they require the most energy. So it has a whole formula in there. It will help you do it. Again, you can access all of this, and I see that the moderator is dropping these in the chat, which is awesome. Okay, next slide, please. And I know I'm going to have to jump. Finding community. So I really encourage you to find community, find your people, make sure that you are also engaging in a healthy community. So I know that there are some really great Facebook groups out there, but there are also some groups that kind of are based in trauma bonding and this idea of like, who's sicker and just talking in circles about your condition. And so look to find places where people you can talk about those other parts of yourself and connect with people. Community is so good for you. It's scientifically backed studies found that positive high quality social support enhances resilience to stress. So having that community and circle is so important. Okay, so I'm going to we were going to do I wanted you to lock in what you've chosen, but we don't have time today. So what I'd like you to do is just, I hope that you will take one of these tools away with you and lock it into your day.
I was
Thank
gonna
you all
say,
so much.
I think
Yeah.
we have time to just have everybody write one thing. I think you can have that. Like, what's the one thing? I
Okay.
think that's good. Yeah, just really quickly.
Okay.
It's fine. One
Okay,
minute,
yeah, I'm
everybody.
1 minute. I'm sorry, everybody. We had so much to cover. So, yes, if you could just take a minute, I want everybody to just close your eyes, choose a practice, pick one of all of the things I presented to you today. What's one thing? Do you want to do breathing? Do you want to get up and do a circ walk? Do you want to find a community that you're really excited about? What's one thing you want to do? Anchor it in your day. So decide what you're going to do and when you're going to do it. Could it be something that, or is it breathing? Could you do it right after you brush your teeth? And then close your eyes, visualize yourself doing it, actually going in and doing that practice. See where you are, see how it feels, and what your body experiences. And feel the shift. Feel the shift. Notice yourself feeling calmer, supported, and more in control as you bring this practice into your day. And commit. Say to yourself, future me deserves this. I hope this is something that all of you can carry with you. I hope you found something in here that's really helpful. And I look forward to supporting all of you in the future.
Thank you so much, Lily. I know we had so much good stuff in this thing, but you closed this out so well.
Thank you.
And it was just a perfect way to close it out. Everyone, thank you so much for attending the Lupus Wellness Workshop. I hope these sessions were helpful for your own wellness journey. And please take some of these tips, tricks, and tools with you. Please make sure you contact Lily here. Lily does a lot of great work. I'm sure she can answer any questions you might have. And just so everyone knows, we'll be providing a recording of this webinar to all who register. So you have it as a research if you need it. There were links put in the chat. Make sure you click those links. And once again, we appreciate the support of Adiset Bio to enable this event. Thank you, everyone. Thank you to all our participants and our guests. Have a wonderful day. Hope to see you at a future Lupus Therapeutics event, webinar, walk, anything. Thank you.